I think the big advantage is the surgical expertise. This is a cancer center that has dedicated cancer surgeons, surgical oncologists. So in Indiana, for instance, there are precious few surgical oncologists, and we have the largest group of surgical oncology specialists in Indiana. At least we have. I'm not sure where Indiana University is with their numbers anymore, but there's very few surgical oncologists, and they're concentrated, at least in the north half of the state. They're all in Goshen. So that's a big advantage. So the other is for the really big cases here, we have a fellow who does these operations with us, but we've set the schedule so that if there's a really big, complicated case, sometimes we can have two surgeons involved, and that helps out a lot. So two brains are way better than one. They're like 10 in the operating room trying to think through things and trying to conduct difficult operations. So we occasionally team up on cases. So that's the surgical expertise side. And I think beyond that, the model of care here is very unique. It is kind of university built or university like. We have disease teams to try to get a higher level of specialization and expertise in certain tumor sites. Almost everyone is prospectively discussed in multidisciplinary conferences. So you don't run into a situation where, if you're referred to a surgeon first, you get an operation, and then the surgeon sends you somewhere, and then the medical oncologist sends you somewhere. So we generally like to make our treatment plan up front with everybody involved before anybody does anything, because whatever we do has implications on their care as well. And the third thing I would say is unique about Goshen is our model, which is really to try to take care of every problem of every patient with cancer. So instead of just coming for cancer care, we really have tried to structure the program to solve people's problems. We understand that people with cancer have other things going on in their life as well. So there's financial anxieties associated with cancer treatment, which is very expensive. A lot of people want to try complementary things. A lot of people are taking supplements. People are very concerned about what they eat when they have cancer. And because of that, our program is structured so that all patients with cancer have access to expertise in those areas. So we have on-staff naturopathic physicians to talk with patients about their supplements and what they're thinking as far as other types of treatments. We have dietitians, we have mind-body counselors, try to help people navigate through this. We have financial counselors, all of those things, because we're trying to address all the problems that a patient with cancer might have. So I think those are the big unique factors about our program, which I'm pretty confident in saying is very much different, at least in the region, compared to other programs. Not that they're not good programs. I'm not saying that. I just think this is how we built ours, and it is fairly unique in those ways.